I would ask the Senator on the point that you made, and I give you great credit for raising that question to the CBO, because I think it's intuitive to most people that you can't spend money twice, that you can't somehow double count it. And that's essentially what the CBO said in their letter, and I think you quoted from it. They went on to say, CBO has written that savings to the HI Trust Fund would be received by the government only once, so they cannot be set aside to pay for future Medicare spending and at the same time pay for current spending in other parts of the legislation or on other programs. And that's the argument we've been making all along. And I guess, you know, it's finally, the CBO, evidently it dawned on them, and it took your question, I think, to get them to respond this way. But the way that you explained the interaction between government trust funds, the unified budget, and the IOUs that the government writes to itself, perhaps gives some explanation to how they came up with this actually achieving a savings. But you made it very clear, $170 billion actually to the detriment, to the deficit. And as I mentioned earlier, the accounting gimmicks that have been used have understated the cost, the 10-year cost of this. And by the way, my staff corrected me. My off the top of my head calculation, I said it's $177 billion in deficit. It's actually 187. And so you add the 187 to the 170 that you mentioned, and pretty soon you've got what they're claiming is $132 billion savings, turns into a very sizable deficit. And so I would ask the senator from Alabama, again, and I give him, as I said, great credit for bringing this to light and raising this issue with the CBO. What does that mean for this piece of legislation that we're going to be voting on tomorrow? $2.5 trillion expansion of the federal government, financed through tax increases and Medicare cuts, and yet even with all of that, the assumption is that this is not going to meet the requirement that the President set out, and that is that it doesn't add a single dime to the deficit. What does that mean to that commitment on behalf of the President and to this legislation's sort of fiscal situation as we move forward into these negotiations or discussions if this passes tomorrow with the House of Representatives?
This is a huge issue. I remember a few months ago, in a joint session of Congress, President Obama spoke to us. He looked out at the crowd and said, this bill will not add $1 or one dime to the national debt. It was a firm commitment to all the American people who were listening, all the congressmen and senators in that room, would not add to the debt. So what we now know is that this bill is going to add to the debt. There is no doubt about it. The debt of the United States will increase. And it is a dangerous trend that happens in a lot of different ways that's put us onto this course. I think he recognized that you shouldn't increase the debt. He recognized if he's going to create an entirely new health care program over here, it ought to be paid for. And he promised to do that. We've got members of this body, members of the House, who supported the bill based on the promise that it would not increase the debt. But we have now, I think, conclusive proof from any number of different ways, but particularly with the CBO score, that it will increase the debt. So it's a decisive issue as far as I can see.
Senator would further yield, in addition to this revelation, I think, from the CBO, which I think does change the game in the whole debate about whether or not this is a budget buster, which it's been described as, in spite of the fact that our colleagues on the other side have been arguing that it extends the life of Medicare. I think this sort of statement by the CBO certainly shreds the notion that you can have it both ways, that you can that you can double count this money, that you can spend it twice. You can't do that. And I think the American people get that, which is why they believe it will add to the deficit as well. But there are other things in this bill, and there were 8 Democratic...
I would just, my understanding, having looked at this at some length and given it thought, is the legislation will extend Medicare because it increases the Medicare tax, and that will bring in more money, and it pretends that we will slash provider payments, home health care and others, and save money that way. So on paper, it definitely should extend the life of Medicare. Then what do we do with the money? Well, the money that's saved is not staying in Medicare. is being borrowed by the United States Treasury to spend on a new program, and the U.S. Treasury owes it to Medicare, and we can see in the trends in Medicare it won't be too many years, and Medicare is going to want that money. And that's going to leave us over here, and that's why we have a debt. It increases our debt, and we're going to have to pay that back, our children, our grandchildren, really sooner than that. Hopefully we'll be around to pay some of that back. So that's the problem that we have here. It's misrepresentation to say that this creates money that can fund the program on a permanent basis. It does not. It's just an internal debt situation.
Well, if the Senator would further yield, a couple of other items that are being used to sort of get us to where this argument can be made that there are savings from this $132 billion savings and deficit reduction that the majority has talked about, also includes the creation of an entirely new program, this Class Act. And there were 8 Democrat senators who wrote a letter basically asking that the Class Act not be included in this bill, recognizing what many have, and that is that the CBO has recognized, that is that this, while it may show some savings in the early years when people are paying premiums, that it's like everything else. That money, when it gets spent on other things, isn't there to pay out benefits when the time comes to pay out benefits. And so you get this artificial $72 billion infusion of cash in the early years, which is being used to understate again, I think the cost of this and to demonstrate or to use to make the argument that there is in fact $132 billion in savings here or deficit reduction. There's $72 billion that this Class Act represents in that first 10-year window, which, as I described earlier, our colleague on the other side has described it as a Ponzi scheme. But it does create an entirely new program, not unlike some of the entitlement programs that already exist, where payments are coming in now that are being used and spent for other purposes, that someday when the chickens come home to roost, there's going to be another reckoning, and I think again it's another example of a program that a way in which the financial picture with regard to this health care bill is understating its true cost and its impact on deficits in the long run. And I would ask my colleague from Alabama, having looked at that particular program, if he would agree with me that too is something that is going to cost us significantly in the out years, and whether or not that's something that ought to be included as a sort of counted toward the calculation on deficit reduction in this legislation.
I think, Senator Thune, your leadership in exposing this, the way I believe this operates, and you correct me if I'm wrong, but the way I believe it operates is it requires a certain number of premiums now, and the actuaries who score these things say that in the years to come, there'll be claims on those policies, and people will claim more and more as they get older and the years go by, and it becomes actuarially unsound. But in the first few years, on paper, for the first 2 years, it looks good. You got more coming in than going out. And so they're scoring this short-term surplus, correct me if I'm wrong, they're scoring this as an asset, as income to the Treasury, when the contracts that people have when they start paying this money in protects them for years and years to come, and in the future they'll be making more claims than are paid out. And that's why it's actuarially unsound and really will increase the debt in the long run. Would the Senator describe it that way?
Well, I think that that's exactly how it would work, and again, it's another gimmick, if you will, another accounting tool to make this thing.
It's a dishonest thing, really. And when you know a program is not actuarially sound, and it's going to take additional federal government revenue to honor the contracts in the years to come, to count that today as an asset is wrong. And it's improper to do that, and we ought not to propose a plan that has a Ponzi scheme type nature to it.
Well, I don't disagree, and I think that's the
time of the Senator has expired.
I thank you, Chair.
Mr. President.
Would you yield the floor?